All righty. Well, today the plan is to just hammer through some content. We're going to talk about stress today. Stress, which is technically chapter 4 in the book. I am recording. Does anyone have any questions up to now as far as homework assignments or anything? Is everything going okay? Making sense?
Yeah, I kind of thought about it until last night at 9 o'clock, so I had to finish it what happened.
Yeah, and I'm pretty flexible on dates because a lot of you guys are full bore working and going to school, so I'm just tickled if you get it done. That's our goal for this semester. Get her done. That's a Larry the Cable Guy. He's a Lincoln native, so I like that comedian. Anyway, we're going to talk about stress. So in the Canvas shell, I did upload some more PowerPoints, which are just kind of the pre-canned PowerPoint slides that come with the book, but under modules, change it to student view here. Under modules, under section 2, I included chapters 4, 9, 10, and 11. Now the reading doesn't cover all of those pages. If you go back up to the syllabus, there's a list of the reading pages. That's this document here that says page numbers to read for each section. So under section 1, you got a little bit of chapter 1, 2, and 3, and chapter 4, which we're going to talk about today. And then there are a few random page numbers from chapter 45. That's the concepts of aging. And so you'll see chapter 45 will have some reading assignments all throughout this course. And then chapter 45 is aging, and then chapter 46 takes that another step further and talks about death and post-mortem changes. That's kind of a depressing chapter, chapter 46. There's only a couple pages to read in that chapter. And then section 2 has some content from chapter 9, 10, and 11. And then it jumps clear over to chapter 45 and chapter 46. So what I did, I think I showed you the first week, is I just put a Post-it note on each of the page numbers, so that I kind of had an idea. At the very least, a good use of your time is just leafing through those pages. It's got lots of good pictures. So even if you are totally short on time and you can't just sit and read it really thoroughly, if you just flip through there, look at those pictures, you can get a lot of the content from that. The chapters that are really the most bang for your buck, like over the course of the whole semester, I would say if you could get chapter 1, 2 read, chapter 1 and 2, chapter 3 is a little bit of a waste of your time. That's the genetics chapter. Try to skim that at least, though. But if you read chapter 1 and 2, And then now what we're going to talk about today is chapter 4, chapter 1, 2, 4, and then we're going to jump to chapter 9, 10, 11. That's really the meat and potatoes of this whole course. So if you can read chapter 1, 2, 4, and then 9, 10, 11, that would be the most bang for your buck. The nice thing about those chapters is they build on each other. So if you get through chapter 1, you'll notice that this chapter, what we're talking about today, chapter 4, really pulls a lot of the content from chapter 1, starts repeating stuff. So those PowerPoints are uploaded under section 2. I did make copies for you guys that are here. You guys at home are welcome to either print them or just read them online, however you want to do it. Or if you are able to make it to class next week, I do have extra copies of the chapter 1, 2, and 3 PowerPoint from last week. And also this one has chapter 4, 9, 10, and 11. So there's big old thick handout. It's got 4 chapters worth of content, which we will kind of build on throughout the course. So we won't. I did evening clinicals last night on the mental health units at Bryan West. So my feet hurt. I was dumb and I told my students I was taking the stairs and it's on the 2nd floor. So now I'm hurting. But that's cool because that's what we're talking about today. We're going to talk about physiologic stress. And that's what chapter 4 in this book is titled, Stress, Exercise, and Immobility. And I believe that the concept of stress will, if you truly dig into this chapter and start to understand it, it will help you a lot in your healthcare career. This is not talking about some foo-foo emotional idea of stress. How many times have you said this semester, I am so stressed. I am so stressed. We got the pandemic to worry about, and now a record amount of snowfall in Lincoln, Nebraska. We beat all the records pretty much. So the way that we use the word stress is usually talking about the emotion of stress. The way the book, the Pathophysiology book, is using the word stress is physiologic stress. What that means is at the cellular level, at the level of the individual cell in the human body, each cell can experience stress. And stress is a threat to the life of that cell. If the stress, the stressor is overwhelming to that individual cell, no matter what cell it is in your body, that cell will die. Physiologic stress. And so on the PowerPoint, the very first slide talks about eustress, distress, and stress that induces a physical response. Eustress is considered a positive stressor. It's stress that is a positive. And one thing we know about the human organism is humans require stress to stay alive. We require stress to stay alive. If you completely eliminate stress from the human biological organism, that organism will die. An example that this chapter talks about is immobility. Immobility. And so near the end of this chapter, it talks about the bedridden patient. This has a direct application to your life today. For example, a female human who hits the age of 30 starts losing bone density every single year for the rest of her life. The calcium in your bones starts leaching out and your bone density decreases. The only way to prevent that problem really is stress. And so the way to prevent your bones from getting thinner is weight-bearing exercise. Weight-bearing exercise. That teaches your bones to get stronger and pull in more calcium. The best weight-bearing exercise, in my opinion, is walking. Walking. You get out, walk around. That's a stressor, a physiologic stressor, but it's a good thing. And that's what we would call eustress. We have found out that if we can teach little old ladies in the nursing home how to do squats, do a squat like a weightlifting exercise, squatting or deadlifting, we can completely prevent hip fractures. And the way it's preventing that, one way, of course, is it's increasing their mobility, it's increasing their balance, but it's also increasing their bone density. You can drink all the milk in the world, and if you are bedridden, if you're not bearing weight on those bones, they're losing bone density. Calcium is getting leached out of those, and they get weaker and weaker. Distress is stress that then stimulates a person negatively. So I would like you to think about what is a stressor in your life today. What is something causing physiologic stress? I'll give you some things that I think about. I don't know if I mentioned to you that I'm a biohacker. I'm a biohacker. And so I track stress every day. But I track cellular physiologic stress, and I'll show you how I do that here in a minute. But some things that are potent physiologic stressors that you might not have thought about: dirty indoor air. Do any of you guys know how the air quality is in your house? Most of us don't. Not something we ever think about. According to the World Health Organization, though, it's the 10th leading cause of death worldwide. Dirty indoor air. Now, if you look at the actual numbers, because I did dig into this, I was curious, how dirty is the air in people's houses? A decent number of those people that die from dirty indoor air are still cooking over an open fire inside their home, to the tune of like 2 billion people in the world still cook over a wood-burning open fire in their home that's not properly ventilated. As you can imagine, that causes health problems, and it causes physiologic stress at the cellular level. So in my home, I have quite a few air quality trackers. I've always had hay fever. Oh, I'm hearing music.
Sorry. Oh, man. Sorry.
Oh, no, that was nice. That was a nice break, though. Get some tunes. That's what we need to do more often, play music in the classroom. So I've always had allergies. Every year when the pollen gets bad, ragweed is a notorious pollen that really bothers people. And every year when the pollen skyrockets, I get miserable. I itchy eyes and sneeze a lot. And then what we see in the ER when the pollen starts skyrocketing is all of our asthma COPD patients start coming in. And in Lincoln, Nebraska, every year, if you watch your weather app, every year we are in a dirty air red alert warning for certain weeks of the year. Have you guys ever noticed that? I have the weather bug app on my phone, and it tells me, hey, you're in a dirty air. And the real reason for that is particulate matter from farmers in Kansas burning. They burn their weeds and get their cropland ready to plant. Or I don't actually know why they're burning. Maybe you guys know. That might be here in. So they burn large areas so that actual prairie fires can't come through. And yeah. So they do this burning once or twice a year in Kansas. And what happens though is that smoke moves and drifts into Lincoln to where suddenly we're in a red alert air quality warning. It's called the air quality index. And then the ERs fill up. If you're working in an ER, you'll pay attention to that because you know you're going to have a busy night. Every single COPD patient, and COPD is like asthma or emphysema. It stands for chronic obstructive pulmonary disease. And they just come because they can't breathe. And Nebraska actually has one of the highest death rates per capita for asthma in kids. So a kid with asthma technically is a COPDer, the chronic obstructive pulmonary disease. And the dirty air quality, life-threatening, and is a potent physiologic stressor. There's lots of other physiologic stressors. Anything that is hard on the human body. Dirty water, drinking water. We're pretty lucky here in Lincoln, Nebraska, and most of Nebraska, we have clean drinking water. Not all places have that. And in fact, dirty drinking water leads to the leading cause of death in children worldwide, which is gastroenteritis. Basically, catastrophic diarrhea. You drink some dirty water with some giardia or other pathogen in it, and for a kid, that diarrhea can be deadly. They poop so much, they become dehydrated, and they die. And it's actually one of the top 2 leading causes of death in children worldwide. Luckily in the United States, for the most part, we have clean drinking water. but that's a potent physiologic stressor. The water we drink, the air we breathe, but I would say the number one physiologic stressor for everyone in this room, it's not actually school, it's not actually pathophysiology. The number one physiologic stressor for you guys is the food and substances you eat. The stuff you put in your mouth.
Even
And
liquor?
same with me. Liquor, did someone say?
Yeah.
Alcohol, absolutely a potent, extremely lethal physiologic stressor to
Hey,
every single cell in the human body.
hey, all
I
right.
know, I know that sucks, man. Everybody's gonna leave today. I'm like, I gotta get a beer.
So,
There's nothing I can do. No. Absolutely, though, alcohol is probably, I would say, the two most toxic substances in the world for the human organism. Number one, corn syrup. Corn syrup. Number two, probably alcohol. And number three, cigarette smoke. I would say in that order. And then probably number four, methamphetamine. And number five, heroin. Heroin killing a lot of people. It's a toxic physiologic stressor. Tobacco smoke, still in the United States, each year, cigarette smoking kills 500,000 people. 500,000 people every single year, and has done that for the last 100 years.
I got
So
a
if you-
question.
Yeah.
I have a question. So, what about cannabis? You know, marijuana. I'm just, I just want to say what's on everybody's mind. That's on my mind. Like, hey, what about that? You didn't mention that. You
No, I
mentioned
didn't
liquor,
mention that.
but not
And
that. I'm like, yeah.
So there's a reason I did not mention cannabis, because if you look on the Center for, I'm getting these stats from the Centers from Disease Control, the CDC website,
Okay.
and the World Health Organization website. Both of those two websites, I'll show you those real quick, because if you're in nursing school or pretty much any certification program, you'll have at least one exam question on cdc.gov. So when you take your NCLEX for nursing school, they'll want you to have gone out to this website at least at some point in time. So cdc.gov. And that's, the CDC is for the United States. It's for just the United States. And then the World Health Organization is the international website. So, and I specifically did not mention cannabis. I would say it's not even in the top 1,000
Hey,
causes
man.
of mortality and morbidity. Alcohol, absolutely.
All right. Say less. Say no more. Thank you.
That being said, I've always been in nursing, and so I've never used cannabis, because you're endangering your nursing license. If you ever get THC on a drug screen, even though it's legal everywhere now,
Right.
it's not legal for nurses. And they will always, like the State Board of Nursing, will always want to know whether or not you were impaired at work. So as of right now, as for a healthcare professional, it's not really an option. It's perfectly legal to be an alcoholic. You can be an alcoholic, shut your liver down, and the State Board of Nursing, well, we don't care. Well, they do, but But if you're a weekend warrior and you're just drinking on the weekends, you could shut your liver down and
Fact.
and still be a healthcare provider. But you show up positive for THC one time, which stays in your urine for a long time. You could have been on vacation in Jamaica. 2 weeks later,
Hold on a
be in a
second.
cup at work.
How long does it stay in the body for?
I'm not positive, but isn't it like 2 weeks or something, or 3 weeks? Anybody know?
Guess I'm quarantined.
And I think yeah, you're on quarantine. Don't be peeing in a cup anytime.
I've heard it can last as long as 31 days.
As long as 31 days. I
Yeah.
believe it. And I believe the reason for that is because the THC molecule is, it likes fat. It's lipid soluble. So you can store it in your fat tissue, so it could just stay there for a long time. Even though it's not in your bloodstream, but you can still test positive for it.
Moving
But
on.
if we go back to the leading causes of death in the United States,
Right.
I want to reiterate again that 500,000 people die from smoking cigarettes in the
Right.
United States. That's the same number of people that are projected to die of the coronavirus this year. So we made a really big deal about this COVID pandemic, and it is scary. But nobody's really mentioning the fact that, oh, that same number of people are still dying from cigarette smoking each year. In the United States, 3 pandemics that we currently have, other than the COVID, is what are called the deaths of despair. And we see skyrocketing cases of 3 things. Number 1 is suicide. Suicide rates are increasing. Number 2, alcoholic liver disease. Alcoholic liver disease, ALD. And so we noticed this back in 2015. So it's been about 6 years now that we've recognized the people dying from liver disease is just skyrocketing from alcohol. And then number 3 pandemic is the heroin/fentanyl overdose pandemic. So those are called the deaths of despair. Alcohol and heroin being pretty bad for you. They're pretty darn bad for you. Right now in the Nebraska unicameral in our Senate, they are debating a marijuana bill right now. There's several bills actually. One is for
South Dakota passed it.
yeah, a lot of places passed it.
That's crazy.
Just recently.
Just slacking.
It'll be interesting to see what comes of that. I'm hoping to get the senators who wrote the bill to come speak to my nursing students this semester.
ASAP.
It'll be awesome. See what they think. So we're talking about physiologic stressors. Anything else you guys can think of that it's hard on your body? I mentioned corn syrup. Corn syrup.
Sugar.
There's a pretty good chance that all of the people in all of the nursing homes in our state and in the world are there because of corn syrup. If you know anybody with Alzheimer's disease or Parkinson's disease, any of those neurodegenerative disorders, they're called, where your brain cells just start dying, corn syrup seems to be a big culprit. So if you don't get anything else out of this lecture today, I would encourage you to look at some of the ingredients lists on your food at home. See if you have
Throwing
anything.
everything out the window then, because everything is corn syrup.
Everything
I
has
mean,
corn
everything
syrup.
got corn syrup and sodium.
Yeah, yeah. So do look at your ingredients. It's pretty hard to find food that doesn't have corn syrup in it, but a good strategy for grocery shopping is stick to the outside aisles. Because if you look at the outside aisles of any grocery store, like if you just go around the outside, you'll first hit the fresh fruits and vegetables. A head of spinach does not have corn syrup in it. And you circle on around, pretty soon you're at the fresh meat section. A fresh steak does not have corn syrup in it. And you keep circling around, you know, milk, yogurt, for the most part, does not have corn syrup in it. So think about that. That's a potent physiologic stressor. You will get horrific diseases from what you eat, what you put in your mouth. So I mentioned corn syrup. I didn't even mention regular sugar. Regular sugar. That is a potent physiologic stressor.
You gotta just shut down all the donut shop.
Yeah.
Dunkin' Donuts.
Dunkin' Donuts. You could make the argument that Dunkin' Donuts kills more people per year than the COVID.
But I love it.
You could definitely make that argument. Potent physiologic stressor. Let me get back to the PowerPoint. Acute stress. Are you guys able to see this? Let's see. Nope, I forgot to share my screen. I got 2 places to share it. The book wants you to know the difference between acute stress and chronic stress. Chronic stress could easily be described as the Western lifestyle. Our Western civilized lifestyle really induces chronic stress, and the way that we measure that, there's several different ways to measure that, but one thing we measure is a stress hormone called cortisol. Cortisol. It's pumped out by your adrenal glands. And that's how we know that screen time is actually a physiologic stressor. How much time you spend staring at a screen can be a physiologic stressor. And if you think about reading the news, no matter what news site that you get on, we can measure your body's response to reading different news headlines. And now our society is just online all the time, 24/7. And so we have this physiologic stressor, just a barrage of sensory input that we did not evolve to handle. The human organism, we did most of our developing 10,000 years ago. And we didn't have those constant sensory inputs. The world has gotten much smaller. So if somebody dies a horrific death in a country halfway around the world, it comes right to our phone. That could be considered a physiologic stress, and in Western society, we call that a chronic stressor. Do know a little bit about Cellier's general adaptation syndrome. I know that in nursing school, you'll have this on just about every class that you take. You'll have a question or two on an exam about Cellier. He calls it the general adaptation syndrome. And so what happens is your cells of your body are trying to maintain homeostasis. There's been some kind of an insult, a physiologic stressor, and your cells are trying to get back to baseline. Baseline is what we call homeostasis. Stress involves your nervous system, so your brain, your spinal cord, and all the nerves in your body, but it also includes the endocrine system. The endocrine is all the hormones. I just mentioned cortisol. That's one stress hormone. But also your immune system. Your immune system is all flared up. In the short term, all of these responses are protective. But in the long term, you have a diminished effectiveness. So the 3 stages to know: alarm stage, that's the first stage. The resistance stage, your body is trying to cope with the stress. But then if the stress overwhelms the human body, you have the exhaustion stage. So there's Cellier's 3 stages of response. I was noticing some exam questions in my mental health nursing class, and then also the advanced med surg class that I'm helping teach. And both of those classes, which are the final classes for nursing students, have questions about Cellier's 3 stages of the stress response theory. During the alarm stage, we have activation of the central nervous system, and then the sympathetic nervous system kicks in. So SNS stands for sympathetic nervous system. The sympathetic nervous system. When the sympathetic system kicks in, we tend to call that fight or flight. Fight or flight. So imagine you're walking through the woods. Maybe here in Lincoln we have Wilderness Park. It's a nice little wooded area on the west side of town. You're walking through Wilderness Park and you hear a mountain lion. Every once in a while they say you can see a mountain lion in Wilderness Park. And it growls and starts coming towards you. What will be your physiologic response? Basically, your sympathetic nervous system kicks into overdrive. Another example could be public speaking. Have you taken a speech class lately? Some of you guys have. So when you get up in front of the classroom to speak, that's a public speaking scenario, and your fight or flight system kicks in. And so as nurses, we measure vital signs. We measure the vital signs to see how much your sympathetic nervous system has kicked in. So what vital signs would we measure? A great example is heart rate. We check your heart rate. I like, when I'm doing a real scary speech, a public speaking deal, I like to measure my heart rate. I got my little fitness tracker watch on and just see how high my heart rate gets. Sometimes it's just sky high and all I'm doing is standing there. I'm not exercising or anything. That's a very normal reaction. What about blood pressure? If your heart rate's skyrocketing, what's your blood pressure doing? Most likely also going up. Respiratory rate. If you have to fight or flight, if you have to either fight this mountain lion or run as fast as you can, what's your breathing going to do? Going to skyrocket. One other vital sign is very important: pupil dilation. When a mountain lion jumps out of the woods to eat you, your pupils get huge. I went to an emergency nurses conference in San Diego one year, and one of the speakers said that they liked to play a game in their ER. We play lots of games in the ER. You have to keep things fun and lighthearted. And one game that they played was use one vital sign to try to predict how soon this patient's going to die. Whatever patient it was, could have been a heart attack patient, could have been a GI bleed patient. The one vital sign assessment that they used was pupil size. Pupil size. They would look at the patient's pupils, and based on how big those pupils were getting, that would tell you how activated the sympathetic nervous system was. And what really kills you when you're having a heart attack? What do you actually die from when you're having a heart attack? As it turns out, it's your own sympathetic nervous system that kills you. You start having chest pain, and your body believes it is in a life-threatening situation, because it is in a life-threatening situation. Exactly like walking through Wilderness Park and having a mountain lion jump out of the woods. So what does your heart rate do? It skyrockets. What's the one thing you don't want your heart rate doing when you're having a heart attack? You don't want it skyrocketing. That's actually what kills people when they're having a heart attack. Their own fight or flight response. So what we do as nurses is we give medications, try to block that. We try to block that response. And a good example would be the blood pressure medication that's called beta blockers. The beta blockers are blood pressure meds that block the sympathetic nervous system. The word beta is just one type of receptor in the sympathetic nervous system. It's almost break time. Let me look. Oh, we got about 10 minutes till break time. I have my alarm set for 2 for break time. So everybody doing okay? Still with me? I'm skipping a few slides. This slide where it talks about the hypothalamus and the adrenal cortex and stuff is pretty confusing. I would encourage you to try to understand that. Read through it in the book. But I would say most nurses working on the floor don't truly understand the hormonal responses of stress and stuff. For test question purposes, they'll usually like to ask you about the exhaustion stage of Selye's. And what that's talking about is basically after a long time, your body can't cope, and now you're at an increased risk for infection. Your immune system is shot. And so the exhaustion stage in school, that's like finals week. Have you ever gotten sick during finals week? That's because you're at the exhaustion stage. You've been studying hard, and now it's finals, pulling all-nighters, and you get sick. Another theory that's more recent, Cellier's theory was developed like in the 1940s, 1930s, 1940s. McEwen is a theory that you'll hear. I would say the only thing to know about this is that word allostasis. Allostasis. You'll see that word from time to time, and that's the dynamic state of balance in response to a stressor. So McEwen talks about the allostatic load. The allostatic load is the wear and tear on the body systems caused by stress reactions. So this is kind of a two-hit problem. You've got the initial physiologic stressor, and then you've got the individual's ability to cope with or respond to that physiologic stressor. And then it can accumulate due to repeated stressful experiences and the inability to adapt to the stress. I had kind of mentioned emotional stress as not the focus of this talk, but I do want to point out that an emotional stressor, like a relationship problem, is a potent physiologic stressor. So emotions can be their own physiologic stressor. As an example, and then we'll take our break. We just got a record amount of snowfall in Lincoln, something like 13 inches, 15 inches, somewhere in there. Pretty impressive. In all of the news reports, I was reading in the newspaper and a couple on the 1011 news channel, all the news reports always have this little sentence that they include in there, which says, be careful not to overexert yourself shoveling snow. If you develop chest pain or shortness of breath while shoveling snow, stop. Why do they include that? Because when we have a snowstorm of this magnitude, the 911 dashboard lights up. People calling 911 because they are having their first heart attack. You got some dude who's in his 70s and he's out there just busting his butt, shoveling snow, working up a sweat, develops chest pain. He's like, oh, I'm sure it's fine. He's got coronary artery disease and he didn't know it, and his heart can't handle that much stress. So that's a physiologic stressor that leads to a heart attack. The heart doctors love it. That's how they pay for their new Tesla. Good old snowstorm. We're going to be busy for the next week. Got to make that Tesla payment. So the most common patient we see that happen to is a male, usually 50 years or older, but we're seeing it a lot younger now. We're seeing 35-year-olds having heart attacks because of our obesity pandemic. So that's men and potent physiologic stress. The American Heart Association, though, did a study probably 10 years ago now, and they realized for women, the first heart attack is usually 80% of the time precipitated by an emotional stressor. They get in a fight with their husband. They get in a fight with their grown children. Somebody dies. Somebody dies close to them. This potent emotional stress causes their first heart attack. And I've had that happen twice now, where I was working in the ICU and we coded a little old man who had a heart attack and died. We did CPR, we tried everything, couldn't bring him back. The doctor pronounced time of death. And then the wife, standing at the bedside, suddenly turns white and grabs her chest. And I say, "Are you okay?" And she says, "I'm having crushing chest pain." We quickly hook her up to the 12-lead EKG, and lo and behold, now she's having a heart attack. And I've had that happen twice, and both times the woman then, whose husband had just died, got herself a coronary artery bypass, what we call a cabbage, 5-vessel cabbage, that same day. So emotions can be very powerful physiologic stressors. So we've been talking about stress. I want to take a divergent little ramble down the pathway of the autonomic nervous system. The autonomic nervous system, because if we can understand the autonomic nervous system, it will go a long way in your health scientist career, depending on where you want to work. But my two specialties, I'm kind of an odd duck because I have two totally divergent specialty areas. I'm a critical care nurse on the one hand, which means I spend a lot of time in different ICUs working with critically ill heart attack patients or septic shock patient, trauma patients. So on the one hand, I've got that critical care stuff in my background. And on the other hand, I'm also a psychiatric nurse. And I've worked on a locked psych unit. I've worked on a locked Alzheimer's unit. And I've done a lot of mental health nursing. Those two areas seem to be totally different. And if you ever talk to an ICU nurse, they will tell you, "Man, I could never do psych." And if you ever talk to a psych nurse, they will tell you, "Man, I could never do ICU." But they all areas of nursing share one very common physiology topic, and that's the autonomic nervous system. And let me explain why. I'm going to draw on this whiteboard, which I don't believe has ever been drawn on before. So I'm very excited to be the first. That's the only reason I'm doing this little tangent right here. So, autonomic nervous system. Can you guys see that okay? That ANS stands for autonomic nervous system. The autonomic nervous system has two branches. Two branches. Boy, this green marker's not very good. Do. Try this green marker. That's not great either. I'm gonna stick with black so that you can see. Kind of getting a little glare from those windows, aren't we? The two branches of the autonomic nervous system are the sympathetic nervous system, the S in S, sympathetic, and the P in S, called the parasympathetic. Each of these two branches of the autonomic nervous system are vitally important. The sympathetic branch is also called fight or flight. Fight or flight. And that's what we were just talking about when the mountain lion jumps out of the woods. Your fight or flight system kicks in, and there's a whole bunch of vital signs and assessments that we can make as healthcare providers. Just how revved up is your sympathetic nervous system? The parasympathetic is the opposite. I like to call this the rest and digest branch. The rest and digest branch of the autonomic nervous system. We could also call it the feed and breed branch. And for the first 15 years of my nursing career, I spent all of my time thinking about and reading about and studying the sympathetic nervous system, the fight or flight branch, because I believed it was the most important when it comes to the critically ill patient, and also when it comes to the patient having a psychiatric emergency. And so both of those two patients, my two favorite kind of patients, the rip-roaring heart attack patient or the truly psychotic individual who's running down the middle of O Street completely naked with a Bible and a sword, those two patients, we always thought had one thing in common. Their sympathetic nervous system was completely freaking out, totally revved up. And our thought process as healthcare providers was that if we can just tone down the sympathetic nervous system, everything would be okay. And that's true to a large degree. Last night I did clinicals and we were on the child and adolescent psych unit. A very common medication that we give kids who are having psych issues is a pill called clonidine. Does anybody know what that is? Not Klonopin. Klonopin is a benzodiazepine. Clonidine is a blood pressure pill. It's a blood pressure pill, and we give it to kids all the time who are having psychiatric emergencies. Because if we give that clonidine, it tones down the sympathetic nervous system. It tones down the fight or flight. We also give that exact same medication to people having a heart attack or having a hypertensive crisis or having a stroke, to tone down the sympathetic nervous system. In the last 5 years, though, and this isn't in your book, and so it won't be on the test. This is just a little bit of free content for you, but this is where the cutting edge technology is going. We've discovered just recently that the most important branch, as it turns out, is the parasympathetic nervous system, because that branch tells us how much stress you are currently experiencing. And so I like to track both branches constantly. Right now, my Fitbit is doing that. I'm trying a Fitbit out. I can't say I recommend this device, but probably most of you guys have a smartphone. Have you ever played around with the health app in your smartphone? Did you notice that it can measure in real time your stress? They may have an iPhone or an Apple Watch. They may have an Apple Watch.
Yeah, I've tried that before. It does actually work.
If you have a Samsung phone, you can use the camera, and it will act. It gives you instructions, but you put your finger over the camera. If you have an Apple Watch, it'll measure your stress. So let's talk about what vital signs go with each branch, and then hopefully we can figure out how your watch or your phone is able to measure stress. On the sympathetic side, we kind of mentioned some of the vital signs. I wonder if I pull this in a little closer, if you could see better. That seems to work. Are the letters backwards for you guys? No, that's working. Okay. Sympathetic branch, probably the most important vital sign we measure is, let's see where I could write this, heart rate. Your heart rate. How fast is your heart beating? And in fact, your resting heart rate, RHR, resting heart rate, is the best predictor that we have currently, the best predictor for how long you are going to live. How long are you going to live? Are you going to make it to your 90s like your grandpa did? My grandma right now is 96. No, I think she's 98. I don't even know. I've lost count. She's in her 90s. The only problem with grandma is she's had Alzheimer's for like 15 years now. So even though she's in her 90s, she doesn't know us anymore. It's kind of sad. But I've always wondered, did I inherit her genetics? I hope I did. Live a long time. The best predictor, resting heart rate. Does anybody know what your resting heart rate is? Like 55? That's a great resting heart rate, 55. That's kind of telling us how healthy your heart is. And the theory, which was developed in like the 1960s, not actually very accurate, but it's interesting to think about, a cardiologist who said the human heart only has a certain number of beats. And once you get to that number of beats, you're dead. And there's been some research that supports that, which says that the slower your resting heart rate, which means at night while you're asleep, sound asleep, the deepest part of the night, how slow does your heart rate get? That's your resting heart rate. The slower it is, the longer you live. That's a feature of the sympathetic nervous system. I'm not a big fan of the Apple Watch yet. I'll tell you when I change my mind. But right now, as a health tracker, it's crap. And I'll tell you why. The battery doesn't last all night. So most people take their Apple Watch off and charge it at bedtime. You never get an accurate resting heart rate if your watch is on a charger while you sleep. We can use most of these devices to predict if you have the coronavirus, if you have COVID, but we can't use the Apple Watch because nobody leaves it on. Anyway, resting heart rate, sympathetic nervous system. How long are you going to live? Other vital signs, blood pressure. We measure blood pressure to tell us how the sympathetic nervous system is doing. We measure respiratory rate to tell us how the sympathetic nervous system is doing. If it's revved up, all of those numbers go up. Up, up, and up. Resting heart rate goes up, blood pressure goes up, respiratory rate goes up. So that leads me to my next critical thinking question. What vital sign tells us how the parasympathetic nervous system is doing? And this is where the new technology comes in that's not actually probably in the book. At least I haven't. I'm reading this new edition and I haven't come across it yet. We measure the parasympathetic with a vital sign called heart rate variability, HRV. That V stands for variability. The reason it's a relatively new technology is because of smartwatches and smartphones, and also affordable heart rate monitors that are accurate. So an example would be a Bluetooth chest strap heart rate monitor. Does anybody have one of those, like to go running with? You can get them at Walmart. The Bluetooth ones are like 40 or 50 bucks. Because of those affordable technologies, like 10 years ago, nobody could do an EKG at home and measure their actual heart rhythm very accurately. So we never used heart rate variability as a measure of the parasympathetic nervous system. But now you can do it with your smartphone. And go into that stress app and find out exactly how stressed out you are. Heart rate variability is a measure of the parasympathetic nervous system. Any questions about that?
Does that track your heart rate over a period of time?
Well, it's actually a super confusing thing. I'll draw you a picture real quick. I got to erase all this off the board to show you what it's actually tracking, which I'm getting a little bit ahead of myself. we don't talk about heart rhythms until the cardiac chapter, which is section 6. But I'll give you a taste of what we will be covering. We're going to talk a little bit about how to read cardiac rhythms. Just a real brief introduction, but when your heart is beating, it is generating an electrical signal, and we can measure that electricity. And what that looks like is got a very recognizable shape. When your heart beats, the sinus node fires first and creates what's called a P wave. And then there's a QRS. And then there's a T wave. Does anybody know how to read rhythms? Somebody was a cardiac monitor, anybody an EKG tech in here? I was thinking one of you guys, I can't remember. If you're interested in a really cool job, at all 3 hospitals, they always hire monitor techs, they're called. You have to be a CNA, and then they train you how to read heart rhythms. I always thought that looked like a pretty cool job to learn how to read heart rhythm. Anyway, what the heart rate variability is measuring is from the very peak of your heartbeat to the peak of the next heartbeat. It measures the distance. And as it turns out, there's a slight speeding up and then slowing down, a slight irregularity in your heartbeat. Just very, very slight. You won't be able to feel it if you check your pulse. That super slight irregularity changes while you breathe in deeply and then breathe out. And it's called heart rate variability. And it's very noticeable in kids. So if you have young children, if you do have a stethoscope and listen to their heart beating, you can hear it be pretty irregular. That's actually a very good thing. So with resting heart rate, the sympathetic nervous system, the lower, the better. With heart rate variability, the parasympathetic, the higher it is, the better. The sympathetic nervous system, resting heart rate, predicts how long you're going to live, whether you're going to make it to 90, 100 years old. Heart rate variability, the parasympathetic branch, which your smartphone can measure, tells you what percentage chance of dying in the next 24 hours do you have. So heart rate variability is turning out to be a very potent tool that we can use in the ICU to predict how soon you're going to die in the next 24 hours. That's parasympathetic nervous system. If you have a heart attack, maybe later today, you're shoveling snow, you develop chest pain, you find yourself laying flat on your back in an ICU at Bryan East, or maybe at the heart hospital. The lower your heart rate variability gets, the more likely to die in the next 24 hours. That makes sense? That is so incredibly confusing, isn't it? Any questions about that? We'll talk about that a bit more in class because the way it applies to mental health nursing is that one number also tells us how your brain is doing. It tells us how clear you are thinking, how good your memory is, And if you're a heroin addict, we can predict how soon you're going to relapse based on that one number. Heart rate variability, the parasympathetic nervous system. Anyway, let me erase this board and then I'm going to sit down and we'll keep plugging away at the PowerPoint. I feel like a vlogger. I'm walking around. I got the, I'm going to be a YouTube star. Hey. So any question about stress, exercise, and immobility? That's chapter 4 in a nutshell. I skipped some of the boring stuff there at the end. So now I would like to talk about chapter 9, which is inflammation. Inflammation and dysfunctional wound healing. What is inflammation? Inflammation and the immune system really go hand in hand. This is the body's response to an injury or a toxic insult or a potent stressor, something that you ate. The goal of inflammation is to wall off the injured area, prevent the spread of injury, and bring the body's defenses to the needed area. The phrase body's defenses is talking about your immune system. Your immune system. Things like white blood cells. Acute inflammation is rapid and terminates quickly. And then you've got chemical mediators that orchestrate a response. We talked about this briefly last week. It was one of the active learning questions for the exam coming up. The 3 phases. Increased vascular permeability. By vascular, that's just a fancy word for your blood vessels. And permeability just means they are getting leaky. They're leaky. Cellular chemotaxis is talking about white blood cells and other cells moving to the area that got injured. Chemo means chemical, taxi means moving. So chemotaxis, white blood cells rush to the area, platelets rush to the area. And then cyst. Oh, you have a question? Oh man, hang on a sec on Zoom. I'm gonna try to shut the blinds because it's ridiculous in here. It's really bright. How do you shut those blinds? Pretty sure it's this thing here. Nope, not that thing. This thing? Something's happening. I guess that's awesome. I feel powerful. If you guys are interested in what's happening, I got automated blinds in the room. Kind of sweet. It's much more.
Those are actually pretty annoying when because they only let you take both of them down at the same time. They don't let you do like one at a time.
Yeah, that's a good point. So, oh well, we're finding out all kinds of weird little things about our new building. I think they finally got the women's restroom working, did they? So that's good. Anyway, my brother's convinced that the artificial intelligence in the building is going to get tired of us pretty quickly, and there's going to start we're going to start having mysterious deaths because the building is sentient. It's got an AI built into it that's watching us right now. Super creepy. I'm kind of exaggerating a little bit, but so the inflammation, I would say everything that bothers you about your own health probably can be explained by this chapter right here. Have you ever had aches and pains? Have you ever had a joint that was bothering you? Have you ever had brain fog where you can't think real clearly and your brain feels a bit foggy? You drink a lot of caffeine to try to remedy the solution, but that is most likely simply inflammation. Essentially, everything that goes wrong with the human body could be described by this chapter. The vascular permeability is where you start getting leaky blood vessels. Leaky blood vessels. Different substances are implicated, like histamine and bradykinin. They dilate blood vessels. And remember that inflammation is a protective mechanism. It's trying to protect your body from insult. But then when the inflammation gets out of hand, we start to have problems. An example of vascular permeability, if you're interested in trying this later, we were talking about alcohol as a potent toxin, a potent stressor to the human organism. What we know about alcohol is one night of drinking, and heavy drinking, according to the World Health Organization, heavy drinking is 4 beers if you're male, 2 if you're female. So if you've ever had a night of heavy drinking, in the morning the next day, you had this entire slide happening in your lungs, in your lung tissue. Alcohol causes a potent inflammatory response throughout your whole body, but especially in your lungs. Have you ever been out at the bars after a Husker game and had a few drinks? Doesn't have to be a lot. And the next day you had a cough and cold symptoms, and you thought to yourself, no wonder I got sick. I was just in the Husker Stadium with 60,000 other people. I'm sure there's all kinds of germs. As it turns out, alcohol itself causes all of these classic signs of inflammation in your alveoli, which are the little air sacs in your lungs. So we get redness, swelling, heat, pain, and loss of function. Basic inflammation. This is what that vascular permeability looks like. Things start getting leaky, and the reason for that is so that white blood cells and platelets can move out of the blood vessels and start healing that area, the area of injury. If it gets all infected, that leakage, the fluid that's leaking out, if it's infected with bacteria, we tend to call that purulent exudate, which is also pus. pus is nasty. If you ever watched on YouTube, they've got, what's that doctor? Pimple Popper. Dr. Pimple Popper. If you ever watched any of those, very disturbing. I can't watch them. But I think the reason I can't watch them, because like, as an ER nurse for years, that's what we did. We incised and drained. The doctor would make an incision, get that infection out. The one thing that YouTube can't capture is the smell, because they smell horrible. And so when I watch it, sometimes I have like the memory of the smell, like a pilonidal cyst or a deep abscess. When it's infected, we call it pus. A transudate is usually not infected, so that's a clear, watery, like a blister. You get a bad sunburn or burn yourself on the stove, you'll often get a transudate, which is a non-infected blister. If that blister starts getting cloudy, the liquid starts getting cloudy and smelly, now we're worried about also being infected. An abscess is a collection of that pus, but it's walled off. It's walled off somewhere. And the treatment for that is the doctor usually has to make an incision and cut into that. Otherwise, that pus will never drain. It'll just sit there. And antibiotics don't help because the blood supply doesn't get down into the actual collection. So we usually have to cut that open, drain it. And that's what Dr. Pimple Popper is doing a lot of times. An effusion is an accumulation of fluid in a body cavity. A common example would be a pleural effusion, where you got fluid collecting in your lung, in your chest cavity. That cellular chemotaxis is just chemical signals that attract white blood cells and platelets. The word margination is referring to how the white blood cells, they tend to line up along the endothelium, which is the inner lining of the blood vessels. So the white blood cells kind of line up there, and then they start releasing inflammatory mediators. Inflammatory mediators are just chemical signaling, chemicals that signal something. That's what inflammatory mediators are. Your endothelial cells are just a vast network of cells that line every single blood vessel in your body, but they do all kinds of stuff. They do all kinds of stuff, primarily releasing chemicals that do different things. If you want to experiment with your endothelial cells later today, hit Walmart and buy a pre-workout supplement, specifically one that has L-sertraline in it. There's one at Walmart and it's just called NOS, N-O-S. Nitric oxide synthase is what that stands for. And that's actually a chemical that your endothelial cells of your blood vessels release. What does it do? It tells the blood vessels to get bigger, So weightlifters and people exercise who take a pre-workout, it almost always has some kind of CNOS in it, which is nitric oxide synthase that serves to dilate the blood vessels. That's the exact same thing that's happening in inflammation. If we go back a couple slides, to where you get the redness and swelling, those blood vessels are dilating. And that's good for healing because it increases blood flow. When we talk about sepsis later, we'll talk about how that's the core problem of septic shock, all those blood vessels dilating. It's healthy when you're exercising and you've got a healthy heart. So the pre-workout supplements are not bad for you. I wouldn't say. The research seems to show they're actually pretty good for you. The only negative of a lot of pre-workouts is the huge amount of caffeine they put in those. That can cause problems, but they may take a pre-workout. You've taken different things. Read the ingredients when you get home and see which one activates NOS, nitric oxide. L-sertraline, there's another one, and I can't remember the other ingredient that also does it. Anyway, cytokines and chemokines, fancy words for inflammatory mediators. A couple that are important. Well, by important, what I mean is they've been studied the most. There's literally thousands of different cytokines and chemokines. Most of them, we have no idea what they do. We have a pretty good idea of what tumor necrosis factor does and the different interleukins. They're always discovering more interleukins though. So like interleukin 6 is an inflammatory mediator that we know is implicated in anxiety and depression, just as an example. Each interleukin, each type of tumor necrosis factor, we're starting to identify different health problems associated with that type of inflammation. C-reactive protein that's actually a lab test that we measure. It's part of the inflammatory response. But if you go to the hospital, we don't know what's wrong with you, we will measure your C-reactive protein. It could be that maybe you have the coronavirus. It could be something totally different, like rheumatoid arthritis. And your C-reactive protein will go up, and that tells us, yep, there's an inflammatory problem, something going bad. Fibrinogen is another one. It binds to red blood cells and fixes them into stacks that precipitate. We measure this with the ESR, we call it, the SED rate. That's how the doctor will refer to it. Can you get a SED rate? Does anybody know what an erythrocyte is? That word?
Red blood cell.
A red blood cell, yep. It's just a red blood cell. And what we do then is we draw your blood, we put it in a test tube, and we just wait for the red blood cells to float down to the bottom. And they just slowly float down to the bottom. And there's a poor lab tech whose job is to run the little stopwatch. Start, and then they slowly settle down to the bottom, and then they stop the stopwatch, and we call that the ESR, the SED rate. And it's a lab test that's telling us that we've got inflammation going on somewhere. Somewhere there's inflammation going on. The interesting thing about fibrinogen is that's also a blood product that we give as nurses. We give fibrinogen. for somebody that's bleeding to death, usually from DIC, which is disseminated intravascular coagulation. It's part of sepsis. They're bleeding to death, and we'll run in there and give them a whole thing of fibrinogen to help stop the bleeding, hopefully. So we measure it as a lab test, but we also give it as ICU nurses. These two, I would say you definitely don't need to know. Serum amyloid A or hepcidin. As you progress through the nursing program, you'll dig into the different types of white blood cells. So do try to study these a little bit. Do any bedside nurses actually know the difference? Not really, not really. The only thing we really pay attention to is the total white blood cell count. You will need to know that on your patient. So the lab report comes back and it tells you the total of all the white blood cells, and then the lab test breaks it down into the different types. And for the most part, bedside nurses don't know the different types. It's kind of interesting, some of the different types, like eosinophils. I had a patient one time with sky-high eosinophils, EOs. The EOs were sky-high. I'd never seen that before, and I had no idea what it meant. And this was actually before we Googled everything constantly. So I called the lab, and the lab lady said, well, with EOs, they call them EOs. When the EOs are that high, it's always a parasite. So you better check and see if your patient has a tapeworm, most likely has a tapeworm. The EOs go sky high in response to parasite. She did not have a tapeworm. She had this thing called cysticercosis, which are actually these little worms that live in your brain and lay eggs in there. I'm seriously not making this up. I would Google it, but it's a disturbing picture. It's a common problem in parts of the world that have dirty drinking water. And so
What's the name of it?
I'd have to Google it. Let me do that. I know I didn't say it right just now. I have to do this every time. Totally mangle the spelling and then see what comes up. Cysticercosis, pork tapeworm infection. The problem is they like the nervous system, and so they will tend to lay their eggs in the brain. The patient will present with usually mental health symptoms, psych symptoms. Might be acutely psychotic, they might be super confused. And then we check their labs, and the only lab test that's elevated is the eosinophils. And we're like, what? Then we got to scan their brain, and there's fewer than 1,000 US cases per year. But if you go to South America and some places like that, you will see a lot more. And this is what their brain scan will look like. So sometimes those white blood cell counts do mean something and are important for your patient. For the most part, though, we're only looking at the total white blood cells. Any questions up to this point in time? We kind of covered a lot of stuff today, haven't we? Just hitting it all. So they talk about liver or fever, histamine production. A lot of this stuff, I would say, don't dig too deep into. For the exam coming up, which is next week, right? Definitely go back to the active learning questions that we talked about in class. The way I would study that is dig in a little deeper to each one if you can. Do your own independent research, read the book, hit Wikipedia. Don't tell anyone I told you that, but I'm a big fan of Wikipedia. You can go off on complete rabbit trails and learn a ton about pathophysiology on Wikipedia. Don't cite Wikipedia for your discussions, though. People in health sciences frown on that. I don't, but my coworkers do, so don't cite Wikipedia. Some other fields, like specifically computer science and artificial intelligence and also mathematics, if you read research from those fields, they cite Wikipedia constantly. It's pretty interesting because that's where the cutting edge science is happening with artificial intelligence and mathematics and stuff. But anyway, kind of interesting. I think we're done for the day. I really don't want to just totally overwhelm you guys. Definitely hit me up, send me a message if you have any questions about the exam coming up or any troubles with the whatchamacallit, Davis Advantage things. I think your discussion posts are looking amazing for you guys that are getting them done. Any questions from you guys on Zoom before we go? No. I will post the recording of this in an announcement in the next day or two. So see you later.